Good day, everyone. My name is Nifemi Ayilomi, and you are welcome to my YouTube channel, Cleft Lip with Nifemi Ayilomi. So today, I'm very happy about today because we are already making progress. We have talked about a few things. So if you missed any of our episodes, please go back and look at them. They are all very educative. We've been able to talk about what cleft lip and palate is. We'll be able to talk about the presentation of cleft lip and palate. That means what you are going to see to know that this person has cleft lip and palate. We've also been able to talk about the possible causes of cleft lip and palate. Now, I want to talk about the care of cleft lip and palate. However, before I go into that, I also want to talk about the myth. That means the belief, the things that people say about children that have cleft lip and palate. So before we get into the business, please don't forget to like, subscribe, and share this link with somebody. Cleft Lip with Nifemi Ayilomi. We are all here about teaching ourselves and getting the knowledge that we need to know about children that are born with cleft lip and palate, and sensitizing our community so that they can know that this condition is repairable and treatable. But before we get into the treatment, we need to also know what people's beliefs are on this. That's what has brought us to the myth about cleft lip and palate. So many people have been able to say that somebody that has a child with cleft lip and palate, it must be as a result of their infidelity. Most times, the husband or the wife sometimes are the ones that are the feedback of this, because they're the one that gets this backlash more. They will say it is because they have been into some kind of act of infidelity, and this is how God has planned to show their faith or to tell people that they are involved in infidelity. That is not true. Some people also say that children that are born with cleft lip and palate, that they are taboo, that they're not supposed to be seen in the community. Some people even go as far as endangering the life of those children. This is not right. This is not true. That's why we're bringing this knowledge to you. So it is repairable. They're not taboos. Some people have also been able to say that there is a reincarnation. It is somebody that has come back, or it is because you have been rude to somebody, or you have wronged somebody in some way. So the person has come back to show him or herself to you, and has come in the place of that child with cleft lip and palate. No, it is not always like that. And also, some people will also say that this kind of children, that they are the reward of the evil things that somebody has done. No, they're not the reward of evil. Some will even say that these children are possessed, that they are bad luck. No, they're not bad luck, they're not possessed. That they have cleft lip and palate doesn't mean that they cannot be great. It is treatable, just like every other condition. It is repairable, just like any other opening on the body. These children can do well. They can even do great. Some of them will say that it is because their mother walked in the sun. In the sun? No. Some will say it is because you did not put some pin in your clothes. No. Some will even say that they are witches and wizards. They are from the marine world. No, it's not like that. It is not always like that. Knowledge is power. That's why we are bringing it to you. And if you want to know the causes, or let me say the possible causes, we treated that in our last session in some of our videos. Just please look through, and you'll see that these children, they are just like every other child. It just happened, like someone will say, like it's as good as somebody is walking on the road and then you fall and you have a cut. When these children are in the womb, there is some kind of intersection that happened during their growth. When they are forming that part, that they call it the oral cavity, the mouth area. So whatever it is that happened was the one that stopped the interruption, that stopped the process, causing an interruption, thereby resulting in a cleft. So it is repairable, it is treatable, and as I've said earlier, it is free of charge. Can you beat that? Free of charge. Surgery, from birth to surgery to every other treatment that will be, including their speech sessions. It's wonderful. Orthodontic treatment. We're still going to talk about the treatment options. It's one of those things that we're talking about. So all of those things are free of charge. So all those myths, please disregard them. If somebody is still believing in that, refer them to this channel. Share the link with them. Let them go through all our previous videos so that we can have this knowledge together. That is why we are here. And then I want to talk about the care. So when you have children like this, one of the major challenge is how to feed them, because of course they have clefts. So one side of their lip is cut, or the two sides, and then they might now have the palate. When they are eating, there is tendency for aspiration, or when they eat, they regurgitate. That means it comes back out, or they aspirate. So you find them coughing every now and then. So you need to know how to take care of them. You need to know how to feed them. The feeding part is very important. But before I even go to that, we're going to be having some people to be coming in on this show to give us this education. But before we get to that, let me quickly say that the care of children that have cleft lip and palate requires a mother that is psychologically balanced. So the mother has to be aware. You know, most of the time, these things come as a shock to the mother, because the mother is already expecting that this child is going to look like me, it's going to look like my husband, and then you find yourself giving birth to a child that has a cleft. It distorts the mother, it gives them psychological trauma. Some parents might not even want to bond with their child. So it takes us to educating them. The first care is first to allay the fear of the mother. We need to attend to their psychological trauma at that time. And then feeding is a very big challenge because of the cleft. Now, if the child now has a cleft of the lip, especially bilateral, and including the cleft palate, it can be very challenging to feed. So we're going to talk about feeding of children with cleft lip and palate separately, because we're going to teach them on how to place the child. You are not, of course, because of the challenge, so you might need to take some extra care, which is very, very understandable. And also, there are some feeding bottles that you need to get. That you're using feeding bottle does not mean that you will not give them breast milk. You can express for them. Please, a lot of issues that we have is that many of these children are being starved. Their mothers, their parents will not feed them, either because they don't want to bond, or because they feel like because of their challenge, they will not feed. You cannot starve a new baby. They need to eat. So you have to feed them with your breast, directly from the breast into their mouth, or you express and feed. All of these things I'm going to teach them in our coming sessions. However, aside from the care of feeding, these children have to be taken care of like every other child. Clean their mouths, clean their body, take care of them. Their personal hygiene is important. As a mother, because you have a child like that, doesn't mean that you shouldn't take care of yourself either. Take care of yourself. Where people don't hide these children. Don't hide them. Don't cover them up. Don't let heat rashes affect their body. Take care of them like everything. Expose them to fresh air. Cover them when there is cold weather. Give them light clothes in a warm weather. Don't just wrap them off and hide them because of their challenge. It is repairable. It is a condition that is repairable, treatable, and for free. All of those things is very important. Now, do you know somebody somewhere that has this kind of a child? Do you know anybody that is facing this challenge? Please don't chase them away. Let us encourage them that this child can grow like every other child. They can have their surgeries done and they will be fine. When you have been able to encourage the mother and get them stable, you need to try to tell them to initiate bond no matter what. However, a good way of initiating a bond between a mother and child is through breastfeeding. And in the case of those children, breastfeeding might be a challenge. So our next session, we're going to be going deep into the care of children with cleft lip and palate, and then we are going to have a guest, a knowledgeable guest. It's going to be our first guest on this YouTube channel, and I can't wait to have her because she has all the knowledge that she can give. She's a mother. She has taken care of a lot of children that has cleft lip and palate, and she will be in the best position to also talk to us about this care. So my next session is going to be the care, then coming in with our invited guest. Thank you for joining me today. I know you have learned one or two things, and I am happy to be here. Please don't forget to like, subscribe, and share the link, and then we'll see you next session. Thank you very much.